Hello, I'm Andrew Smith, and this is the Power of the Patient Project. Jefferson Health is one of the most patient-centered healthcare systems in the country, with hospital and physician practices throughout Philadelphia, the Philadelphia suburbs, and southern New Jersey. Jefferson Health is at the forefront of making the patient experience a positive one. Bob Johnson is Director of Patient Experience at Abington Jefferson Health in Abington, Pennsylvania. In a recent interview, Bob Johnson explained why patient-centered care is so important to his hospital.
Well, as a healthcare organization, our mission is to improve lives. So if you are going to be focused on existing to build lives, we really need to keep our patients at the forefront of what we do. One of our key values is putting people first, and so it's a matter of doing what we say we're going to do and why we exist. We're a not-for-profit healthcare organization. We're not in the business to generate shareholder value. We're in the business to improve lives. So that starts the conversation for us. I think the other thing, though, is that as an organization focused on improving lives through safe care, through quality health care and care that's patient-centered, it's not possible to be as good as you can be if you aren't in a constructive relationship with your patients and the people who you serve. So very few people think of themselves as patients. They think of themselves as fathers or mothers or sons or daughters, and when they're with us, we need to try to build a constructive relationship with them in that context so that we can give them the best care and they can partner with us as effectively as possible.
Hospitals like Abington Jefferson Health strive to ensure that every patient receives optimal patient-centered care. This is how Bob Johnson explained how hospitals like his achieve this.
So I'm really the leader of a learning system. That's how I look at my work. So the things that I am responsible for help Abington Jefferson Health as an organization, as leaders, as caregivers and staff learn about how they can effectively partner with patients and families, build on their natural talents and skills that they bring to the equation. But we work really hard to provide structure and support, so patients' feedback, opportunities to interact with patients and families outside of the immediacy of a clinical interaction through our patient and family advisory program, for example. But we also work to connect what for most people who get into healthcare was their first step towards healthcare, was their desire to help people. So we provide learning opportunities, we provide structure and process and policy to support that, and then we work with leaders from our president to everyone who works here to have clear understanding of the expectations about how we're going to do that and what skills and behaviors are required, and then we support them day to day with constructive feedback, reinforcement, recognition, and ultimately accountability for delivering the services and care that we want to provide. We try to actively engage our team together. When you have thousands of staff caring for people and many, many more thousands of people seeking care, we're not always going to see things the same way, and we won't always understand their perspectives immediately, but if we start at a basic point of focusing on relationships, demonstrating understanding, then we can do the best that any human being can do in an organization to do that.
Honoring the rights of patients is the focus of patient advocacy. We asked Bob Johnson how his hospital makes sure that every doctor and staff member respects these rights.
Well, it's central to who we are, and so understanding that this isn't an act of beneficence. It's a normal right that's a sign of respect and building trust in a relationship. It makes it important, and as I've said, it's central to who we are and why we exist, and our success at providing safe, high-quality care that's patient-centered. So we really work at framing our efforts around that context, and that by being present and engaging in a relationship, we're improving care. And we've also found, and there's research to support, that a therapeutic relationship doesn't just benefit patients and families, it's actually beneficial to the caregivers as well. Healthcare professionals and staff of all roles are in a stressful, demanding profession, and the evidence suggests when they connect in an empathetic, understanding relationship, it makes them more resilient, happier in their work, and that's also beneficial to the patients and families that we're serving, as well as to sustaining our people who are trying to help the other people.
Patient-centered care supports the rights of patients. Patients should demand that their hospitals honor those rights. I'm Andrew Smith for the Power of the Patient Project.